everyone, this is Dr. ABHIJITH, pursuing MDS in the Department of Conservative Dentistry and Endodontics. I am going to discuss about muscles of mastication. These are a group of muscles that help in movement of mandible during chewing and speech. All these muscles originate on skull and insert onto mandible. They also play a role in the configuration of face. Here is a mnemonic to remember the muscles of mastication. Take time to chew food. The letters in the word time represents muscles of mastication. T for temporalis, I for internal pterygoid, M for masseter, E for external pterygoid. Internal pterygoid is also known as medial pterygoid, whereas external pterygoid also known as lateral pterygoid. These muscles have certain characteristic features. All these muscles develop from mesoderm of first pharyngeal arch, that is mandibular arch. Hence, they are supplied by the nerve of that arch. These muscles are located in and around infratemporal fossa and are inserted into the ramus of the mandible. These are concerned with the movements of mandible at TMJ. Let us see in detail the origin, insertion, and action of each muscle. Masseter. This is a thick quadrilateral muscle. The muscle fibers are arranged in multi-pinnate. It is regarded as the strongest muscle of the body. It includes three layers: superficial layer, middle layer, and deep layer. Let us see in detail the origin and insertion of each layer. Blue denotes the superficial layer, which arises from the zygomatic arch and adjoining zygomatic process of maxilla and inserts onto the ramus of the mandible, whereas the middle layer arises from the posterior one-third of zygomatic arch and inserts into the central portion of the ramus of the mandible, and the deep layer arises from the deep surface of the zygomatic arch and inserts onto the upper part of ramus and coronoid process. One important thing about masseter is this is the most commonly affected muscle in bruxism. Temporalis. This is a fan-shaped muscle. This muscle fills up the temporal fossa. The muscle fibers are arranged in different directions. Anterior fibers run vertically downwards, middle fibers run obliquely, and the posterior fibers run horizontally. All these fibers originate from inferior temporal line and converge to form a tendon that passes beneath the zygomatic arch and attaches to coronoid process of mandible. Before discussing about pterygoids, let me familiarize you with one special bone, that is sphenoid. It is also known as bat bone. The sphenoid bone has two pterygoid plates, medial and lateral. Both the pterygoid muscles arise from lateral pterygoid plate. Guys, remember, both the pterygoid muscles arise from lateral pterygoid plate. Lateral pterygoid. This is a short conical muscle consisting of small upper head and a large lower head. This is regarded as the key muscle of the infratemporal region. It is also known as external pterygoid muscle. The upper head arises from the infratemporal surface and crest of greater wing of sphenoid and inserts onto the articular disc and capsule of the TMJ, whereas the lower head arises from the lateral surface of lateral pterygoid plate and inserts onto the pterygoid fovea present on the neck of the mandible. One important thing about this muscle is This is the most commonly affected muscle in myofascial pain dysfunction syndrome. Medial pterygoid. This is also quadrilateral in shape, consisting of superficial head and deep head. The superficial head arises from the maxillary tuberosity and palatine bone, whereas the deep head arises from the medial surface of lateral pterygoid plate. Both these heads insert into the medial surface of angle and ramus of the mandible close to the mandibular foramen and mylohyoid groove. This slide shows the actions of muscles of mastication. Protrusion is the forward movement of mandible, retraction is the backward movement of the mandible, elevation is upward movement of mandible, depression is downward movement of the mandible. Among every muscle group, there will be one odd muscle which differs from others. With respect to muscles of mastication, lateral pterygoid is considered as odd because it causes depression of mandible, that is opening of the jaw, whereas the other three muscles cause elevation of mandible, that is closing of the jaw. Here is a mnemonic to remember the action of lateral pterygoid muscle. When you pronounce the word lateral, there is opening of jaw, which indicates that lateral pterygoid is associated with depression of mandible. Apart from the lateral pterygoid, there are certain accessory muscles which cause depression of mandible. These include mylohyoid, geniohyoid, and digastric. Both the medial pterygoid and lateral pterygoid cause side-to-side grinding movements help in the protrusion of the mandible. When medial and lateral pterygoids of one side act together, the corresponding side of the mandible is rotated forwards and to the opposite side. The superficial fibers of masseter also cause protrusion of mandible, whereas the posterior fibers of temporalis help in the retraction of the mandible. Coming to vascular and nerve supply, since these muscles are derived from first pharyngeal arch, these are supplied by the nerve of that arch, that is mandibular nerve. The masseter, temporalis and lateral pterygoid derive their supply from the anterior division of mandibular nerve, whereas the medial pterygoid derives its supply from the main trunk. With respect to blood supply, all these muscles derive their arterial supply from the second part of maxillary artery, which is a branch of external carotid artery. This is a short discussion about muscles of mastication, which includes all the important points, and thank you for listening.